Hi, my name is Laura Rohe. I'm a nurse from Omaha, Nebraska, working in private practice. I have spent the last 27 years working for Allergy, Asthma, and Immunology Associates as the immunoglobulin nurse coordinator for our patients on IG and then also for HAE patients. And I'm also a PI patient as well and have been on immunoglobulins since 1989. Well, probably what drew me in was, getting my diagnosis at age 14 with CVID. So I was lucky enough to be diagnosed at an early age and had an immunologist in the area. So, starting on infusions right away and having that chronic disease on replacement, immune globulin. I worked very closely, with nurses in the office and then switched to home infusion. So I really got to know my home infusion nurse well, and I really liked the idea of being a nurse. So went to nursing school and ended up working at my immunologist's office, was offered a job there and just started working in immunology. So I think with infusion nursing, I mean, it's so different than just kind of a regular office, family practice. So we definitely, have a lot of chronic care and do a lot of critical thinking, administering, immune globulin infusions for our patients. So yeah, I think definitely, being diagnosed myself and just really kind of being in awe of some of my home infusion nurses really kind of drew me to continue to work in the field of immunology, with primary immune deficiency patients. A lot of education to my patients on plasma donors and the screening process and that constant vigilance and the safety of the plasma product and kind of explaining to my patients that this is protein that they either don't make or it's not functioning, so they need this replacement therapy, which is life saving, and they need these IgG antibodies to protect them, from life-threatening infection. Well, I would definitely really encourage them, and for the patients out there, and other people who have donated plasma, thank them for that, because it's truly life-saving, for primary immune deficiency. It's the standard of care. That's it. It's immune globulin, and it's you can't make it in a laboratory. It's definitely, we rely on the thousands and thousands of donors, that give us the circulating antibodies, to protect us and keep us healthy. Yeah, it's amazing. I know a lot of my patients are just, really just so thankful, to be on therapy and actually have a diagnosis, whether it is primary immune deficiency or HAE, and be able to have treatment, for their rare disease. Well, I'm a little biased, obviously, because I'm a nurse too. But nurses really are great. They do just kind of act as the liaison between, the patient and the provider, the specialty pharmacy. So I'm lucky enough to get to work with so many wonderful patients with rare diseases. So I mean, nursing really is truly, it's just a wonderful field to go into. And I know so many wonderful nurses, in allergy, asthma, immunology, and then not only that, in GI, with, I have two kids that need to see a GI doctor, and their nurse case manager is just wonderful. I mean, there's just so many great nurse case managers out there that really are, kind of the liaison and the go-to for so many patients. I know that, I'm kind of the jack of all trade for my patients, and they call me with anything, whether it's their physical disease, if they're sick, or, if they're having a swell, or financial, emotional. There's just so many aspects, and it's obviously it's so rewarding being a nurse. So I encourage anyone to go into the nursing field. And infusion nursing, it's you just definitely you really get to know your patients, and it's just a wonderful opportunity to provide immune globulin replacement, to patients with primary immune deficiency. I just think, it's obviously it's a rare disease. There's still so many people that have no idea, what a primary immune deficiency is and what HAE is. So, I just want to thank, PPTA and, nonprofit organizations also such as the Immune Deficiency Foundation and HAEA for just being a wonderful resource for patients. And just, want to thank all of the plasma donors for giving us life and donating plasma on a regular basis, so myself and my patients can live, normal lives.